Assalamualaikum and salam sejahtera. I am Izzatun Hajwa Hassan from Faculty of Pharmacy UiTM. My project is entitled Stigmasterol, Attenuates, Inflammatory Hyperalgesia in Mice. Stigmasterol is a plant cereal that can be found in various parts of plants, be it leaves, stems, fruits, or flowers. Many plant extracts were recorded to have anti-osteoarthritic, anti-hypercholesterolemia, and anti-inflammatory activities due to the presence of stigmasterol. Stigmasterol has been shown to possess anti-inflammatory activity, and one of the key features of inflammation is pain. A few studies have shown the economic impact of pain is greater than most other health conditions due to its effect on rates of absenteeism, reduced levels of productivity, and increased risk of leaving the labor market, hence the use of analgesics. However, adverse effects of pain medication increase the challenge of pain management, especially in the elderly. Thus, the need to find replacement for current therapeutics with minimal or no side effects. The aim of its study was to investigate the analgesic effect of stigmasterol by using various pain models. The pain models used in this study were tail immersion tests, formalin-induced inflammation tests, and acetic acid-induced writhing tests. Male ICR mice in groups of 6 were treated with stigmasterol at 10, 20, and 40 mg per kilogram per os, while morphine at 5 mg per kilogram given intraperitoneally was set as positive control for the tail immersion test, and indomethacin at 10 mg per kilogram per os for the other two tests. The latency of tail withdrawal was observed within 120 minutes every 5 minutes with cut-off time of 20 seconds for tail immersion test. As for the formalin-induced inflammation test, 0.5% formalin in saline was injected at the right hindpaw and number of licking and beating was observed for 30 minutes. As for the acetic acid writhing test, 1% acetic acid was injected intraperitoneally and number of writhers were observed every 5 minutes for 30 minutes to identify the inhibition of pain at phase 1 or phase 2 of inflammation. We found that the tail emission test, mice treated with stigmasterol at 10, 20, and 40 mg per kilogram per os, and morphine 5 mg per kilogram intraperitoneally, had a significant pain inhibition compared to control, 60 minutes after treatment. As for the formalin-induced inflammation and acetic acid writhing test, stigmasterol at 40 mg per kilogram and indomethacin showed significant differences compared to control mice. The finding of this study revealed that stigmasterol has an analgesic effect as potent as morphine and indomethacin. The ability of stigmasterol to alleviate pain may be due to its ability to bind opioid receptors at central nervous system and causes the inhibition of thermal pain transmission. Also, stigmasterol can inhibit the inflammatory mediators such as histamine, serotonin, prostaglandin, and bradykinin that are present in the late phase of inflammation, which stimulate the nociceptive endings. As a conclusion, stigmasterol has central and peripheral acting analgesic activities that can be developed as an alternative to relieve pain or an adjunct with current treatment. Thank you.